Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Has caused us to put aside our behavioral patterns of good health and to adopt more unhealthy practices. And as a consequence, as you mentioned, being overweight, obesity is climbing, diabetes is climbing, and deaths from heart attacks are climbing. And they believe, mostly because people are afraid of going to the doctor, afraid of going to the emergency room, because they're afraid of contracting the virus. And so it's interesting the many indirect ways the pandemic has affected us.
Oh my God, how do I get it off? Huh?
And then, as you mentioned, the stigma of obesity is getting worse as we stay home and eat more bad food and exercise less. So it's an interesting side effect of the pandemic. Any other thoughts on that before we start looking at the papers?
Yeah, Dr. Callender, there may be, because of the pandemic and the isolation, there may be more domestic tension in families, especially husband and wife.
Yeah, right. Yeah. People are forced to stay home with each other. And that has had its impact, just as you mentioned.
Sometimes good, not all bad.
Right, you're right, you're right. Sometimes it makes it wonderful, but some people already had those tensions. It's worse.
Yeah, well, John, I don't know if he's quite ready to put up the first slide. So,
Yeah, well, I think it's yeah, because the other thing that they talked about is how the drop in HIV infections has happened, how it's gone down. Any idea how much the HIV infection has gone down?
10% maybe.
Since we had the peak in the 1980s?
I would say it's gone down 50%.
25.
I said 10. I'm not as out.
75%.
Huh?
I'm going with 75%.
I'll say
And-
20.
And the answer is 73%.
Kevin,
And-
how did you know that? That's great.
And what's even more interesting is that the infection rate from HIV, from needle injections, has gone down 93%. So that most of the HIV infections now are from male to male sex relationships. So that's the only area where it's not going down that much, but every other area has gone down dramatically. So that it's amazing how we've done better about HIV in many ways. Of course, now we also have, it's not a fatal disease now, for the most part. They have medications that you can take so that the disease can be arrested. And actually, you have many people living 20, 30, 40, and 50 years after contracting HIV.
Hey, Dr. Callender, what are the other areas besides male to male?
Well, you still have male to female, but actually male to male, male to female, and HIV and needle injections were the major reason for HIV. And the needle injection was really pretty close to male before, but now it's mostly male to male.
Well, the main carrier HIV is males.
Say again?
The main carrier for HIV is males.
Well, I wouldn't say the main carrier. Yeah, I guess so, for the most part, yeah. The main carrier is males, yeah. And most of the women who are infected get it from the men, so, yeah.
Dr. Callender, in case John Buchanan gets on late, what is the first article that you want to present?
The first article, I guess, let's talk about Biden pledging that the United States would give out 50 million vaccine doses. I think that's
John, in the chat, John Buchanan said, give me 1 minute.
Okay.
okay. But I think that's one of the, of course, I think the article from Houston in which is a good topic because Methodist Hospital in Houston suspended and plan to fire all hospital employees who do not take the vaccine.
Wow.
That sounds extreme. Yeah.
It sounds what?
It sounds extreme. Suppose all hospitals did that.
We hope they do, because
Really?
you shouldn't want to go to the hospital and contract coronavirus in the hospital.
Right.
And there's
Agreed.
data, for example, in the latest survey, for example, at Howard University Hospital, was that 95% of physicians are vaccinated, but only 50% of the staff are vaccinated. And that's generally the case in most hospitals. And you shouldn't want to contract your coronavirus in the hospital from staff who take the virus. So I think there's a policy that is developed already that all hospitals in the District of Columbia and Maryland, personnel will have to take the vaccine unless they have religious or medical reasons for not taking the
I
virus.
thought that was the case in the Methodist Hospital, but if you don't get the staff to comply, what do? It
Fire
will, yeah.
Fire them.
But as a patient, when you go into a hospital, I would think more patients are going to start saying to staff, "Are you vaccinated? I don't want you to touch."
Yeah.
And that's reasonable.
Well,
So-
they won't have to, because the policy in Houston is going to spread around the country, and all the hospitals are going to make that mandatory, just like the flu vaccine is mandatory. And Joint Commission comes around and they check to see if you are following the rules and if all of your staff and doctors are vaccinated, or there's a reason why they shouldn't be. And so that's a practice that is going to, and I think one of the things that they were waiting for was to have enough data and enough people vaccinated so they could make that policy something that is countrywide.
Dr. Callender, that's not the only thing. Since you're working around a lot of sick people, what other things you have to be vaccinated for if you're in the medical field?
Oh, there are many. You have to be vaccinated against hepatitis.
Yeah. Dialysis nurses, we all have to. Technicians, everybody works in dialysis. We have to get that every year.
Right.
So why are they thinking this is so strange?
I know.
It's not strange. It's not strange. It's not strange. It's just people who don't work in the hospitals don't realize that the staff have to take these vaccinations, or else they are not employable.
That's what I was going to say. Yeah, we didn't know that. I had no idea. I mean, it makes sense, but you don't think about it. I guess.
Right.
Yeah.
Yeah.
So anyway, that's already been accepted in DC and Maryland, but what they're waiting for is a time certain for which you will allow people to have time to be vaccinated before you make it mandatory.
Yeah.
So I would imagine that by September, it's going to be mandatory for all hospitals.
Right. And Dr. Callender, at Harvard, we're not even allowed in October last week, November 1st, if you don't have the sticker, I had my vaccination, flu vaccination. They won't let
Oh
you
yeah,
in.
right.
Yeah.
That's
The
right.
staff, I'm talking about the staff, all doctors, nurses, housekeeping, everybody, kitchen
Right.
workers, all of them.
Yeah.
Tatum, I'm ready.
Okay.
All right. You want to start with the whichever one you have up first? Oh, well, this is a very good one to start with because that's also one of the topics that the Washington Post is talking about. How do you get ready to return to normalcy? Question mark. This is something that induces reentry anxiety. The fact that, I went to a restaurant and ate outside for the first time in a year, I guess. And it was interesting that inside people wore masks, but outside people didn't wear masks. And adjusting back to situation where you don't have to wear a mask causes a lot of anxiety among people because they've gotten so out of touch with not wearing masks. So, so of course in DC, most of the people I see in DC are wearing masks.
Yeah.
In Maryland, a lot of wearing masks as well. So, and here's the issue. They say you don't need a mask if you're vaccinated, but you don't know whether people surrounding you are
Right.
vaccinated or not.
Yeah.
And so this causes a lot of stress.
Yeah.
The pandemic caused stress already,
Yeah.
but now we have another stress about do I need to wear my mask? And did the guy next to me vaccinated? And of course, next is going to be going back to the office because many people are working at home.
Yeah.
And so, and one of the things about going back to the office is you're going to have to put your clothes on. You're going to have to get up earlier. You have to travel, take the transportation. All of that's going to change and increase stresses. Also, I've had many more presentations on virtually than I would ever have had going person to person because it takes time to go places. You have to fly, you got to do this, that, other.
Oh, yeah.
Virtually, you don't have to do any of that. And so that's going to produce more anxiety. You have to decide what you're going to do, what you're not going to do. Take time for your exercising and your meditation. I'm glad to see they put that back in there. And I think that all of this it's another source of stress, as if we don't have enough. So it increases the importance of exercise and meditation as well. You can go down, or the next one. Now the question is, any thoughts about the stress associated with returning to normal for you personally?
Well, one of the things that I'm concerned about is the ventilation system. And I think a lot of corporations and managers are concerned about that too, because it's not just employees returning to work, but the facilities at the meeting place and on the job site, are they ready for the workers to come back to work?
Yeah.
Well, the hospitals are because they've changed their ways of doing things. The airplanes are ready, but now you bring up another issue. What about the other places?
Mhm.
Have they changed their ventilation? And I don't know the answer to that one because they need to. Many of the areas have changed their ventilatory practices, but to what extent, I don't know. Have they done to the extent that the air industry has done it? I don't know, but they should, they need to. And I think you raise an issue that is critical.
Yeah, Doc, I went to a restaurant a couple of weeks ago, first time indoors with no mask. I think I mentioned that I saw one person coming in with a mask, but while they were eating, they took the mask off. My bigger concern though is being like in a room, say in a church. um, if some of the churches are now allowing people to come back in, but they're saying you have to have a mask on.
Yeah.
So if everybody does that, I'm okay. I'm feeling okay. But there's so many breakthrough. I think there's like 10,000 so far breakthrough cases and variants that are coming in from different places like India and Brazil,
Yeah.
South Africa. That if everybody has a mask and covers their nose and their mouth, 'cause a lot of them don't even cover their nose. It's
No.
stupid. But anyway, I feel better, but I'm still concerned though.
I think most of the churches will talking about opening by September. So
Yeah.
it's going to be, but of course, at that time, it's expected that we would have developed a herd immunity. So if the numbers are down at that time, then you might not have to worry. But that's the issue. What are the numbers at the time? Is the virus still a factor? Because your concerns are very legitimate. And time will tell as we go from June to July to August. That will help us know in terms of whether or not that it's safe. Because that's what the question is it safe?
Well, is it safe?
I think it's safe by September if the numbers are down. And I think we'll look at those numbers. And if we have 80% people vaccinated by that time, I would think it would be safe. Yeah. So
Okay,
that's
so it's not safe now.
no.
Even for
No.
vaccinated people, it's not.
Clearly in the District of Columbia, it's not safe because so many people are not vaccinated.
But what about the people who are vaccinated? Is it safe for them?
It's probably safe for them. Yeah. Yeah, it's probably safe for them because the data shows that if you've had the virus or been vaccinated, it's very unlikely for you to have an infection. It's possible, but it's very unlikely.
Dr. Callender, why so many people are not vaccinated in DC?
That's a good question, and I don't know the answer to it, but that's a fact. Is that more of the white people are vaccinated than the black people, but there isn't a significant number of either. We're not even close to 70% of either the whites or the blacks. So we got a ways to go in the district. Why? I don't know why we aren't taking advantage, because they're making it available to almost every way you can imagine.
Right.
By having mobile vans and
Right.
by doing it at drugstores and doing it at any place you can imagine. And people are still not coming.
Dr. Callender, what's the difference between this and polio? How is polio transmitted?
Say again?
How is polio transmitted?
It's also a virus.
It's a virus?
Yeah. Mm-hmm.
So I remember, okay, in the 50s or whenever I was living then, we got our polio shots.
Right.
And then you were just normal. I didn't see what's happening now. I went to a church Sunday and they had the contact tracing. They took your temperature and all of this, which put it on your mind more. But I don't know, to me, it just, I guess we should still feel afraid and all that, but I don't. I'm just, I want to treat it like the polio vaccination. We got our shot and went on with our lives.
Well, polio was not like this. Although, in other words, the extent of polio was not a pandemic like this is. And of course, being paralyzed by polio was more than a notion. But you're right, it's different. It's different. Polio is different. Now, this is a kind of a shock to most people that surprise medical billing. When you get a bill, if your insurance doesn't pay, they do let you know about it, but the surprise billing when you don't know about it is something that many of us are not aware of. Most of us who look at our bills actually are aware of it, but for example, when you go to the emergency room and your insurance says that it's not an emergency, then that bill is on you, theoretically.
Oh my gosh.
Yeah, and so that's the kind of billing that they're talking about. And if you go to the emergency room and they get a consult from a doctor, you get a bill from the doctor, which you weren't expecting. And those are the kinds of issues that are becoming more and more. And they talk about protection against this surprise billing, which I think is very important. Because most of you, if you look at your bills, you see what percentage of your bill your insurance is paying. And some of it is surprising, the small amount that the insurance is paying.
I know.
Which means the balance is on you.
Yeah.
So this is something that's going to be becoming a big issue very soon.
In this chart, Doc, it seems that the green, yellow, green, and the light blue are more protected for billing, but the dark blue states they have almost no protection.
Oh
yeah, and I think this is scary.
yeah. It's awful.
I know last year when, excuse me, when I went in to have hip replacement surgery, the surgeon staff called my insurance company and made sure it was all covered before they would even do the surgery.
That's correct.
That's good. Yeah.
Yeah, that's the way it's usually done. And that was very beneficial. We have to give him credit for some things that he did that were important, but this was he signed the No Surprise Act, which offers protection against this, which doesn't go into effect until January 2022. But anyway, it's something that becomes very important as you receive your medical bills. And when you go for surgery or go to, especially the emergency room. Now, you do have a special law that says if you have an emergency situation, the city will pay for that bill. There's an EMTALA rule that covers it regardless, but as long as it's an emergency, right?
Dr.
How
Callender,
about the ambulance?
Yeah, well, that's separate. EMTALA doesn't cover the ambulance, but it does cover the hospital, and the ambulance is expensive.
Yeah.
I heard when my mother got transported from the hospital to the nursing home, that bill was $700 for
Oh
the
my gosh.
ambulance. Unbelievable.
Yeah,
Oh,
that's the kind of bill that you aren't expecting that suddenly hits you.
oh my goodness. Mm,
Yeah, yeah, and you're when they come to get you for some 911 calls, you get a bill for that.
yeah. Uh-huh. Even if you're having chest pains, you get a bill for ambulance?
Even if you have what?
Chest pains and shortness of breath?
Yes,
Oh my gosh.
yes, yes.
That is an emergency, Maya,
Yeah.
but you
Mm,
Oh, it
still,
is an emergency.
yeah, but
Yeah,
you
it is.
still got to pay because we talked a lot about going to the emergency room last week and whether you should go to the emergency room or whether you should go to a clinic.
Or the urgent center.
Yeah, urgent care, right?
Yeah.
And we discovered that if it was a real emergency, you need to go to the emergency room.
Oh, yeah, yeah,
Mhm.
yeah. And after you get there, it's covered, But you're right, the ambulance will send you a bill.
Yeah, and Maya, you're right. The shortness of breath uh, is an emergency.
Oh, your chest pain, uh, loss of ability to use an extremity or loss of vision, all of those are emergencies. Uh,
Out of what fund are emergency workers and ambulance workers paid out of?
What's the question?
Out of what funds are the emergency and ambulance workers paid for
Usually from the city or state, yeah, because most of it's covered under in DC, it's the DC government would take care of that. Uh, they run the emergency coverage, the 911 line, as well as the emergency vehicles.
Then if that's covered, then why are they billing us? If
No, now we said they are covered. We didn't say the ambulance ride is covered. We said that the workers are covered, but you still got to pay for the ambulance. You're not paying so much for the workers, you're paying for the ambulance transportation.
now, how about the homeless people that are found on the street are called 911? Who's
What
going to
about
pay
them?
for their ambulance?
Well, they still get, well, they have no place to build. So, I mean, they don't have a house. So they couldn't be built anyway.
but then who pays for the ambulance?
But they can't pay for anything. So, yeah. So that's not a, yeah, that's something that will be written off because most people who get bills have somewhere to send the bill. And if you're homeless, you don't have a place to send a bill, which is interesting.
So does that mean anybody will go lacking because they have no place to send the bill?
No, no, they still go to the place. They pick up the place regardless, but they send bills to people who have a home.
So the advantage of having a home is a disadvantage because you got to pay for it if you got a home.
Right.
But if you don't have a home, you don't have to pay for nothing.
Right.
Well, I don't know that that's an advantage.
Because I
You
had
could call it that. I don't.
I don't know. I had a relative, and I found out that they get cell phones, and
Yes.
where we have
Oh,
to pay for cell
you
phones,
have to pay. Yeah,
they get cell phones and everything else. So
that's right.
I don't
what?
know about everything else.
But
What do you mean everything else?
Groceries.
yeah,
Food stamps.
Yeah, food stamps. That's right.
Well, that's good. Yeah.
and
Yeah.
Social Security.
Yeah,
The government pays for all of that,
And
though.
stimulus.
yeah.
No, they don't get a stimulus.
Oh, they don't?
No, because they don't usually file taxes or anything. You have to be a person who files taxes in order to get it.
Some of them don't even have an identity.
Hmm.
Well, my brother doesn't file taxes. He's disabled. He gets stimulus checks. He's under the government pays everything for him, and he got stimulus checks.
Well, somebody
Yeah,
did.
but that's not the same as the homeless person who often doesn't even have an identity. Some of them lose their identities, which is one of the most disturbing aspects of being homeless.
That's why they filed. Somebody filed the taxes for him, Maya, and they did it because they knew that he was eligible for a stimulus.
No, they told us they don't file taxes, and I haven't filed taxes for him when he was living with me for 30 years.
And he
No.
got a stimulus check for
Yeah, he gets a stimulus check. Yeah.
every year.
Does he collect?
Whenever the government gives out stimulus checks, he got that 1,400, before that 600. Yeah. And I put it towards his funeral insurance. Yeah.
Did he collect Social Security?
He gets Social Security
That's it.
and he gets, because he's disabled since he was born.
Yeah.
And he's under the District of Columbia Government of Disability Services. So they pay for everything, food and everything, the way he stays, group home, medications. He's got Washington, D.C. Medicaid, Medicare Part A, B, C, D, all that stuff. Yeah.
He must have an advocate that's taking care of all of his.
No,
I'm
he's disabled.
I'm his advocate.
No,
Yeah,
I'm
he's
talking about the
disabled.
one that does all the paperwork.
There's no paperwork, John.
No, it isn't.
It has to be.
Social Security.
Social Security.
One of the,
It has to be paperwork
Why you say that?
because he was living in a group home.
No,
He
he said
did.
Maya.
Yes.
But they get a computer run from Social Security of everyone who is receiving Social Security, and that's how they base their distribution.
I'm sorry, dear. What is that? What did you say? I didn't hear you.
No, I was saying that if you are receiving Social Security, the stimulus corporation would receive a computer listing of everyone who is receiving Social Security, and they would make distributions based on the reports that they get from Social Security.
Yeah.
That's how my mother-in-law received hers.
Right. All the nursing home patients received it too, because my husband's sister, she's 68 years old, and she's in the nursing home in Rockville for 3 years. She gets her stimulus checks too. Yeah.
And so that's what I was saying about the fact that there is paperwork that has to be done, but the person, that paperwork gets done on behalf of those people.
Oh, I don't know, dear.
Well, I mean, you can call
Social
it
Security.
if you want to. It's these days that's done by electronics.
Right.
Yeah.
Social Security, like they
You call
said.
it paperwork, it's electronics.
Yeah.
Yeah.
Social
Get a
Security.
Social Security check, all that's sort of automatic.
Yep.
Right. Yeah, it is automatic. Yeah.
Yep. So there is paperwork, and the government is taking care of it.
Yeah.
Okay, whatever. What do you think about this?
What is that?
This interest in the transgender laws and barring athletes from participating in girls and women's sports. What are your thoughts about that? Is that important or?
Dr. Callender, I have a question about just the definition of that. What does that actually mean? Transgender. What
What
you
is
know?
that? Yeah.
Yeah.
What does transgender mean?
Yes, sir.
Yeah.
It
Yeah.
means, well, gender relates to what you were born with in terms of whether you're born with a penis or vagina, uterus, ovaries. And so if you are born with a penis and you want to become a woman, then that's transgender. If you're born with a vagina and you want to become a male, then that's a transgender.
Oh, okay.
Because that's what's defined as your gender. And so so this then refers to the student athlete who was born with the gender of a female who wants to become a male and vice versa. And so there's a lot of debate about what is the right thing. And it's probably an unending issue because you're talking about fairness and who determines what is fair. And so this is causing a lot of interest and discussion to transgender rights, because as we know, there's a lot of transgender abuse and there's a lot of discrimination against people who are transgender. And so that's what this is all about. And when it comes to sports, if you're born with a ovary and uterus and a vagina, should you be, and you want to become a male, and I guess the biggest issue is if you're actually a male, you're born with a penis and you want to compete with women, is that fair? The other way around is not as much a debate as the issue of if you're born with male gender with a penis and testosterone, whether you should be competing with women when you were born as a male.
Yeah.
That's what the debate and discussion is about. What are some of your thoughts about it?
I had a question just briefly. Aren't there individuals who have both organs, male and
Yeah, they are so rare yeah, yes, there are people born with both organs, right? And that becomes a special issue because that isn't transgender, right?
Okay,
That's
if
not
they-
transgender.
I think if they let science and the medical field take over and make the decision, then it wouldn't be a controversy.
Yeah.
Because males, I think, about their body structure and their mass, about their muscle development, even though women can develop muscles just like men, men still have an advantage over women in certain sports.
Right.
That woman develops that. I may be wrong because I really haven't done any thorough study about that, but I just think that that's the way it goes. And we cannot say that men and women are equal as far as our body mass and structure and the way we do jobs and everything. Women can develop. I've seen women muscles and everything. It doesn't look nice, but bodybuilders and all that kind of stuff. Dr. Callender, so what is the difference between a male and a female as far as the body mass and their athletic ability?
Well, you're talking about the testosterone and estrogen levels. And many of the athletic organizations have used that as a guide. What is your testosterone level? What is your estrogen level? But the debate still goes on. But your point is well taken that the testosterone results in a different body structure, as does the estrogen level. So that the battle goes on, especially as it relates to transgender. And since transgender is an issue that has become more and more discussed, this then is something that has not been determined by solely the medical profession.
Would it matter if a person who is transgender comes out early or starts their transformation when they're much younger before they build some of that body mass? Or?
Well, that's the issue that has not been determined yet. But and some of that would be determined by the testosterone or estrogen levels. But the problem, as you would know, is that many of the people who are born male who want to become female, they take estrogens, and vice versa. The people who want to be males, they take testosterone. So that complicates things, makes it difficult to make a decision. And so that's why it's not solely a medical decision. Well, where in many ways you might think that would be the better way to do it, but the complication of people taking feminizing hormones and masculizing hormones makes it very complex.
Dr. Callender, the men who are trying to be like women, the girls, I mean, going to the bathroom, it's scary. He might, rape some girl or something, I don't know. It's scary to see a man, oh my God, in a woman's clothes.
Well, it's interesting because that is something that I'm sure you addressed in the hospital, because for a while that was an issue. And that's why in the hospital, you'll notice recently, they don't have males or females, they have both, because that has caused a lot of consternation, the fact that transgender will use the bathroom. So therefore, in most hospitals, you'll see signs that show male and female rather than male or female.
In different other countries, how do they handle it? I mean, I heard that like in China, someplace that men and women all use the same bathroom.
Yeah, that's true. And that in Europe, that is the case. That's how they handle that issue, but that is not, that does not handle the transgender issue. The difference is that they don't have, they don't make a difference.
Okay, and transgenders, they have to make a concerted effort to actually change their sex organs, or can they keep their what and just think what they want to be?
Well, they decide what they want to be at after the age of 12, and they then may have surgery to take away the penis and transform it into a vagina, or vice versa. So they have those operations, but they also take masculinizing hormones and feminizing hormones. So it becomes a complex issue.
They need a parental permission for that?
After the age of 12, you don't need parental permission.
Oh, gosh. Oh,
which is problematic to me.
that is horrible. Oh,
It's
So a
problematic.
13-year-old knows what he wants to be, and his parents just have to say, okay, he can do with his body what he wants to do.
Well, I think that's too young, but
yeah.
when you think about it, when you get confirmed at 12, right?
Huh?
Don't you get confirmed at 12?
What do you mean confirmed?
Catholic.
Oh, well, those people who don't know what confirm means,
Catholic.
you make a decision about whether you're going to become a Christian or what religion you're going to be at the age of 12. And in many religions, that's when the age that you can say, I want to become a Christian. And so the church will confirm you in some religions. And so that age of 12 is interesting, because if we use that as the age for confirmation, then some people feel it's okay, therefore, for you to use that as the age of having the ability to decide what sex you are. I think that's a little young, but I think that's what's on the books.
Dr. Callender, but they won't do surgery in the hospital if you're a minor. They say you need, if you're below 18, you need your parents'
The
permission.
exception is sexual issues.
Oh, I see.
The sexual issues, the law has changed so that, for example, you don't need parental permission to take medication if you have a sexually transmitted disease after the age of 12.
Oh my goodness.
So the rules have changed a lot. It's amazing. We talked about the sparing the rod and spoiling the child, which is a biblical statement. But the laws are not based upon the Bible. The laws are based upon whatever the laws are based upon, and they don't go by the Bible. And so you have a situation where the Bible may say one thing, but the law says something else.
Well, they said in the last days it'll be worse than ever. So
That's correct.
So they're giving our children a choice to make things that are really detriment and things that are not detriment, then we still get a chance to control them. So,
The world is going to hell in a handbasket.
Right. That's true.
Okay. This is interesting that they had 2 passengers that were tested positive on the first North American
my
cruise.
goodness.
And it's interesting that that would occur even though they were vaccinated.
I heard them say they hadn't reached that 2-week period after vaccination.
Right. I saw that.
And that's
Yeah, so it's going to be interesting to see what happens as a follow through.
Mhm.
And you see what they did. They forced them to remain until they tested negative, and then they'll send them home. They didn't say anything about whether they're going to refund their money.
Oh, no. Yeah, they, some of the hotels will test you in the hotels. Some of those tests cost a lot of money too, at least $60 or $70, $80 or more.
Yeah, I know.
And then they won't even let you go to the airport if you test positive at all.
You want me to pick some up Friday?
Yeah, it's interesting. When you decide to travel these days, it's more than a notion.
Mm.
Well, all of that is part of the re-entry anxiety.
Right.
You still got to
Absolutely.
go through all these things as if the
Uh-huh.
pandemic is worse than ever.
Right. Talk about stress. Yeah.
Going back to the office you mentioned earlier,
Yeah.
going back to work, traveling, everything.
Yeah.
That's not re-entry if you still got to go through all this mess at the airport and everywhere.
I know.
You're right. That's part of re-entry anxiety. You can't do
Yeah.
the things that you used to do. You can't do it the same way you used to do stuff.
Right.
That's why when you ask when will things get back to normal, it's probably 2022 will be the earliest,
Yeah.
because there's so many things in between. But it's interesting because I just got a notification about my basketball season tickets, and they're preparing for normalcy in October. So
Oh, my.
You know, the other thing, Dr. Callender, I think that there are people that are going to continue wearing their masks for a
Yeah.
long time,
Yeah.
and they're going to continue to stay 6 feet apart from people.
That's right.
And the good thing is that they will continue to wash their hands and
Yeah.
brush their teeth and all that kind of stuff.
That's true.
They're going to continue to do that even after they say it's okay to go out,
why do you think so?
because they're paranoid now about viruses and diseases.
Right.
Well, that's not the only reason. The other reason is that the incidence of viral infections has decreased because of that change.
Yeah.
And so what you mentioned is accurate, but what is also accurate is that the incidence of virus infections has decreased significantly because of these changes.
Yeah.
And
I've
so
heard
those two
nothing
together,
about flu.
huh?
I said, I've heard almost nothing about incidences of flu since, they've been wearing the mask.
How many of us have had the flu since we started wearing masks
That's what I'm
and
saying.
social distancing?
Yeah.
Probably very few of us.
Yeah.
So it seems those practices benefited us.
Yes. Yes. I heard on the news though, in end of December or January, that flu had decreased. They used to have 40 to 50,000 deaths a year, but last year when we have at the pandemic in 2020 end, only about 9 to 10,000 people died from flu. So they said masks are working.
Yeah, that's right.
Yeah.
Do you all
Those are
remember?
good.
And it's also good for allergies.
Yeah.
Keeps the-
Yeah.
keeps you from-
Yeah.
So, okay, you want to go down the line on this one? Because if the staff have it, then uh, you almost have to cancel your trip. But of course, all you do is take those staff who are positive and you take them out of the crew staff. So
Yeah.
any of you gonna take a cruise?
No.
No, I'm not.
No,
No, thank you.
No.
Then I wasn't gonna take one before either, so my vote don't count.
No.
Dr. Callender, they're trying to open back up, going to see plays and
Oh,
concerts and
yeah.
stuff.
Yeah, I think in the fall that'll. And you talk about New York Broadway being crippled. They
Oh, my gosh.
completely eliminated. Yeah, can you imagine people who were making their livelihood because of Broadway? They just completely gone. Yeah.
I know about this company, the Little Theater of Alexandria. I worked for them as their parliamentarian. But what they had to do was they had to go into their reserves money in order to pay their staff during the pandemic because they couldn't have plays and make any money from the public.
Yeah, this has been quite a trying period.
Yeah.
You talk about affecting the economy. Wow.
Yeah.
A lot of people lost money during this time.
Yeah.
Lost lives and money. Right.
Mhm.
What about booster shots? It's interesting. This is an interesting topic because we still don't have the full answer because there's a lot of studies that demonstrated that the immune system is boosted up for a significant period of time. And he talked about the polio vaccine being a lifelong immunity, and whereas others like tetanus is 10 years and the flu is every year. And so the question is, where does this stand? And we don't know the answer.
Yeah.
But we're still looking because those people who got the vaccine in last summer, we will be getting their studies to find out if they have immunity at 12 months.
Right.
And that's the question. When we get an answer to that, that will help us decide as to whether or not we'll need a booster shot.
Right.
I heard that the transplant patients, I've heard you all say that you all, the immune system is different. So I heard on the news that they are saying that if the transplant patients were to get a third shot,
That's correct.
it would, yeah.
Yeah, that's correct.
I thought of you guys when I heard that.
Right. That's what they said recently. We don't know that is going to be the answer, but that does sound like that's the current theory on that because we haven't done enough studies on those who we know now that those who got 2 shots that was not enough.
Okay.
So the third shot may be enough, may not be, but we need to give them a third shot and find out.
So look out, John.
Yeah, it probably means that there's a way that they can test the efficacy of the shot that you've had, and they've already said that the first shot was 50% or 60%, but when you get the second shot, it goes up to 90%. So I don't know, the third shot would be necessary if the efficacy went down, then you would need that third shot.
Well, yeah, that's why you would need to have tests, antibody tests and other tests to determine whether or not it worked for you and whether or not you needed to take that third shot or not. Because the antibody levels after the second shot were not what were expected for most of the immunosuppressed patients. So, and of course, we don't know whether it matters if you've been recently immunosuppressed or you've been immunosuppressed for 10, 20, 30 years. We don't know the difference in that group of patients. So it's going to take some studies to get an answer to that. First, for those people who are not immunosuppressed, and then for those people who are immunosuppressed.
How do they do that test, Dr. Callender, for the antibodies?
Oh, they just draw blood from you, just like Gloria nurse who talked to us. They take specimens from her every month or so.
Mm-hmm.
And so they do the antibody test, take blood from you, test your antibodies, and just find out what titer or what level of antibodies you have. And they call them neutralizing antibodies. And they test as you mentioned, the efficacy of your neutralizing antibodies and ability to kill the virus.
Dr. Callender, there are other people who are also immunosuppressed, right? Not just transplant recipients, right?
Correct. There are people who take immunosuppressive medications for a number of entities, including rheumatoid arthritis and many other conditions. And there are cancer patients who take special medications that immunosuppress them. So there's a significant percentage of people who are immunosuppressed. And there are diseases that cause immunosuppression. So it's a category of people who it's important to do studies to get the answer to that. Now, we talked about this last time as well, about the mRNA viruses being associated with heart inflammation and the fact that this heart inflammation may not be require hospitalization, but it is a fact that it is more common.
There's a perfect example, Dr. Callender, where someone might have to take one of those immunosuppressant drugs like prednisone, which you take a lot of times for inflammation, and inflammation of the heart would fit that category, I guess.
Yeah. Mm-hmm.
Dr. Callender, the doctors say that prednisone increases blood sugar. Is
Yes.
that true?
Yeah, it causes diabetes, yes. It
Prednisone?
does. Yes.
Oh my gosh.
Oh, yeah. It's well known. Well known.
God.
It's diabetogenic, yes.
That's what happened to me, Maya.
Oh my goodness.
Yeah,
Oh.
if you get salumedrol, yeah, it's not uncommon. No.
Oh my goodness. So for pain they give you get diabetes then.
No, but well, okay, it's not everybody that gets it. Certain percentage of people, you will get diabetes from it.
Oh my
Most people will
God.
not, but a certain percentage of people will get it. And and when you get a high dose of steroids, temporarily, the blood sugar does go up. So it also depends on how much prednisone you're on and how much steroid you're on, because there salumedrol, which is the drug that is good for the COVID virus, that's at that level, it causes a temporary rise in the blood sugar, but it's not long lasting. But it does definitely cause a temporary rise in the blood sugar, and some people more than others.
Oh,
Dr. Callender, as you know, right after my liver transplant, I had to be diabetic, and I was diabetic for 9 months, and then it went away, Maya. And then after my kidney transplant, I came down with diabetes again.
Oh
But
my.
this time it lasted about 6 months and it went away.
And it's usually from the steroids.
Right. And this time around, here's my third time becoming diabetic. And this was right after my COVID shot. And after a hospitalization, I came out with it.
Oh no.
But it looks like the same thing is happening. It looks like it's temporary. And so I'm praying that
Yeah.
this one is temporary.
The only thing I want to interject, John, is that you had a steroid shot in September, and that's when it started. I think it's because of steroids again, and not because of the COVID.
Well, I think that this is good news that United States is donating 500 million vaccine doses around the globe. I think
Yeah.
that as a developed country, we have a responsibility to try to help those countries that are not able to pay for it. And I think that I'm happy to see that we are doing that.
And he's gotten other countries to come along. So that's good.
What'd you say?
I said he's also gotten other countries, President Biden. To
Yes.
To give it to them.
Yeah, and that's important because one country can't do it all.
Mm.
Yeah. The other developed countries. Now it's interesting that we no longer consider Russia as a developed country, but
Yeah, it's
before the division of the USSR, it was a developed country. But
Dr. Callender, I have a question for you. I mean, they're saying we have so many vaccinations and all that, but all these people are coming, thousands from the border. Why are they not vaccinating them? We don't
I
even
can't-
have them.
I can't. I think that's a political question that we'd have to ask the government. I don't know the answer to that.
Mm.
That ought to be a requirement for entry.
Yeah, I agree. I agree.
Mhm.
I really think they're doing something at the border about that. Like they're either testing them or giving them shots. They're not letting them just in. I don't think they're just letting them in. There's a lot of paperwork. You talk about paperwork. Oh my goodness.
What?
Well, that's an issue we don't know the answer to, so it's mostly speculation. So, but I think it's clear that they probably would not allow somebody to enter the country without being sure that they're COVID negative. We talked about this before, about the hospital suspending,
Yeah.
and if they don't take the vaccine, they will be
Yeah.
fired. They'll be terminated.
Good.
And
Mhm.
it was interesting because the people who sued said that this medication is experimental.
What?
And we know that that's not the case. So,
Oh.
and that's why the judge threw it out. Yeah, the technology's been around for at least 10 years, so it's not
Yeah.
experimental at all.
No.
Yeah.
My question would be whether there was mandatory for them to get the shot regardless of whether they tested negative or positive.
It is required, right?
Either
That's-
way.
Yes,
So they don't even have to test them. You're going to get the shot and without the test.
that's correct. That's correct.
Okay.
This is the same. This is this fact that they sued, but the judge did not agree with it and threw it out of court. And especially if you're going to say it's experimental, which it's not. I think you need to come up with another reason. Experimental is not that. It's not a good reason. There may be other reasons, but you say that you have religious reasons or
Yeah.
a medical reason. Makes
Right.
sense. But to say that it's experimental is not a good reason. So
No.
they're going to have to, when they take it to another court, they're going to have to come up with another reason than that experimental, because that's not going to work.
No.
And they'll use this case as a reason to throw it out.
Oh,
Dr. Callender, do you ever get a chance to talk to your twin brother about these issues these court issues?
No, I haven't really because, no, I haven't. No. They seem, and these seem so simple and straightforward. They may be, but no, I haven't spoken to him about any of those issues.
Yeah, this issue is a slam dunk, is what you're saying.
Yeah, right. And I hope it encourages those people who take the case up further to come up with another argument. Because it is frivolous if you're going to call it experimental. It wouldn't, you might come up with other reasons, but to just say experimental, it's not going to work.
No.
Now, this is an interesting article about the J&J, because remember they came up that there's a Baltimore factory that
Right.
didn't do it correctly. And so they found unsuitable batches. And so that's not good. I mean, it's just, as a matter of fact, they shut down the factory.
Oh, my.
Yeah. So it's interesting that there are places who try to cut corners, and that's dangerous to all of us.
Yeah, and said they had mold. Oh my God.
Yeah.
Ooh.
Keep trying to bring poor Trump in there. He has enough problems. They try to bring him in everything.
In a mold, the newest vaccine that's trying to get approved, didn't they say that they use mold or some sort of mold or moth? You said moth? Is it moth? Okay, my husband said moth. I may be wrong. As to help develop the vaccine.
Well, who in Ohio won $1 million? That's going to be interesting.
Yeah.
This guy won $1 million and another guy won a college scholarship. Well,
That's nice. That's nice. Yeah. Very good. I'm happy for them.
Yeah.
Very happy.
But look at it, it was adopted in 5 states. We need to have it in DC, I guess.
Yeah, we do. Yeah.
We're not a state, though.
Not yet.
It's coming.
We have a chance now that the Senate is Democratic. Have a chance. I can't say that.
Yeah.
When it was Republican, there was no chance. Being undervaccinated is something that we're fighting against, and it still remains reluctance. And when you find numbers so low as at Howard University Hospital, where 53% of the staff, only 53% of the staff are vaccinated, it points to the reluctance on many areas to taking the vaccination shot.
And they're not setting up.
Because that's at the hospital. What about outside the hospital?
Yeah, that's right. How about the patients? How they feel about it, people. If they're not taking it, why should I take it? They'll say, Yeah.
Well, the answer is obvious, because you want to live.
Yeah, that's right. Absolutely.
Yeah.
My question is, when someone has to go to the hospital, does the hospital automatically, if they're going to stay for a while, does the hospital automatically give them the shot?
No. Nobody does anything automatically. What you do is you do the test and see if they're positive or negative. But they do not automatically give anybody the vaccination.
So if
that's something you have to request.
What about if they test positive? I'm sure that there's a form that they can sign, giving permission to give me the shot.
There's no such form. No such form. That's if you have the the right to request that. There's
Well,
no
no, I'm
such
talking
thing.
about a case where the person is in the hospital. They
But
test.
you don't give anybody a vaccination unless they request it.
Okay.
Oh,
All
Now
right.
you,
So,
if you have COVID, we treat you,
mhm.
but
right? But we don't give you a vaccination.
Dr. Callender, the doctors and nurses don't encourage the patients at the hospital to
No,
get
no,
the
I guess
vaccination?
that was not the question about encourage. He asked, do you give it? And I said, no. We
The
don't
other
give it.
question after giving it was the fact that you said that they treat them if they test positive.
Yes,
And so
Mm.
that treatment that they give them if they test positive seems like it would be to give them the shot.
well, remember, a vaccine is to prevent the disease. We have treatments for diseases, which is different from preventing the disease.
Uh-huh.
You know, the treatment for COVID is high dose prednisone, monoclonal antibodies, and remdesivir. Those are some of the three. There's antibody treatment, steroid treatment, and remdesivir. Those are the three treatments for COVID, which is completely separate from being vaccinated.
Thank you. That answers my question.
Yeah. Now, one of the problems is that the use of the antibody is not what it should be, because we still have people who are over 80 who are reluctant to take the vaccine who come down with the disease, and then they have to be hospitalized and treated. And so that remains a concern. And the more unvaccinated states you have, the more likely you are to still have the disease to present itself. And that's why the goal is to try to get herd immunity or get 70% of residents fully vaccinated. That's the aim.
Dr. Callender, I heard that the state of Washington reached that threshold. My sister lives in the state of Washington. That threshold of 70%, I heard that Washington State had it.
Is that one of the first states to reach it?
Yeah, I think so.
Yes.
Mm.
And so, but also the thing about Washington State, if you all remember, they had a choir rehearsal with about 60 some people there, and they all came down with the disease.
Yeah, I remember that. And I remember that was one of the first places that they had the outbreak of COVID in the nursing homes.
Right.
Right. And now they've completely turned that around.
Amazing, yeah.
Yeah, that's
Wow.
good.
Yeah.
They list their last big COVID restrictions as California.
Wow.
They were the last state to adopt masks. Well, it's good to hear that California is still addressing it, because Los Angeles was one of the last places to really have a focus on it.
Yeah.
The mayor of California was on one of the late talk shows. I look at James Corden, and he was praising the state for all they had done to get to that 70%.
Yeah. I saw that too.
Is that him right there, Betty?
Yes, yes.
He's a Democrat too, Dr.
Yeah.
That's
Yeah.
the governor.
Yes, pretty funny as well.
He's a Democrat.
Yeah.
92% of California seniors. That's
Oh,
good.
really? Oh. Dr. Callender, I have a question for you. You know, my brother is in a government, run by district government, day program, and they just started off. And one of his advisor, she's not taking it. She says she's taking herbs and everything. And she's telling the families, us, don't give those vaccinations to your people. Is she allowed to tell people not to take vaccine, Telling
Well,
the families, don't give vaccine to your,
well, there's freedom of speech, so she's allowed to. Is it good for her to do that? No, but we do have freedom of speech, so she can. That's unfortunate, though.
it's
That's very
horrible.
unfortunate. Yeah,
Mm.
and she should keep her personal practice to herself.
Thank you. Thank you.
But yeah, that's kind of bad.
Thank you. Thank you so much. Thank you.
Question is, what's going to happen with the schools in the District of Columbia? What do you retired teachers think about is going to happen in the district relative to public schools opening and reopening? We know that most of the colleges are going to require a vaccine. What about the public schools? Any thoughts about that?
I wouldn't go back teaching if the kids were not vaccinated.
Yeah, good. Mhm.
Any other thoughts?
I think that they should go back and back to school in person because their the at home learning is not sufficient. That's what I've been told.
That's clear. And I think that schools should reopen, but I think teachers and students should be vaccinated.
Yeah, I agree. Mhm.
That's the same article that we had before.
Right, we did. Yeah.
Now, what has always been interesting to me is that Disneyland never closed.
What? Oh,
No, Disneyland never closed.
I thought it's closed. Oh,
On Disney World either. So, I mean, it's amazing that those places stayed up. It's amazing. What is amazing is people went there. That's what they stayed open because people went there and they continue to go there, which
yeah.
is amazing. That, of course, they didn't have nearly the crowds they used to have, but it's kind of amazing to me that they survived through all this pandemic. Isn't that unimaginable?
Well, did it cause the rates to go up? Was there contact tracing? Did anything happen because they were open?
I don't know, because one of the things about that is the people who come to Disneyland and Disney World are not locals. They come from all over the world. So I don't know how you track it. Well, those are some of the most interesting aspects of the news today. Any other comments?
Yeah, I have a question for you. Oh, go ahead. Go ahead.
Yeah, I just saw an interview with that lady. What's her name? Marjorie
Oh yeah, Taylor.
Taylor. They're trying to fire Fauci, and I was going to see if I could pull up the interview. I mean, it's really I feel like throwing up listening to it. She's in Congress trying to get Republicans and everybody to fire Fauci.
On what basis?
Saying that he is the cause of the government being shut down and people not working and not going to school. He's the cause. And they said, well, he's not a government person, so they should get rid of him.
Oh, okay. That's not a very good argument.
Oh, it's stupid. I mean, it makes me want to throw up listening to it.
Terrible.
I'm gonna see if I can find it.
Well, then that is. I hope you don't find it, because it's not worth discussing.
Oh man.
I have a personal question for you, Dr. Callender. So when you go back to your basketball games in September with all those people, you're going to wear your mask or you're not going to wear a mask?
It all depends on what the numbers are. If we have herd immunity and the numbers are down, I won't need to wear a mask. Because that we're talking about October. So by that time, we should know what the numbers are. And if we have herd immunity and the numbers are down and we don't have the infection as an issue, then I wouldn't wear a mask.
Okay, thank you.
And I would go to church without wearing a mask either, if that were the case. The numbers are down and we have herd immunity in DC. I would feel safe going to church without a mask. With those circumstances, right? And they did a survey in Asbury about that. They asked everybody under what conditions would they feel safe returning to church. I haven't seen the results of the survey, but did they do that in your church, Carol and John? Your churches, people out there? You have any surveys?
My church is beginning to open up now. They started with 50, now they're up to 100, and soon, I guess they'll soon resume. But the other churches that I'm affiliated with, they haven't opened up. They may have live stream, but they haven't opened up fully. And I don't know what they're doing. Maybe Betty can tell you, or John.
Did they survey the membership?
At our last church meeting, I asked the question if they would allow us to come back in if we showed that we had been vaccinated, because they're still on this, fear thing, I guess. And their answer was they weren't allowed to ask whether a person had been vaccinated or not. And I just didn't think that was, if we are a private church, I don't see why we couldn't. And whether you ask or not, if they were willing to show you. So.
Well, part of the survey that we had asked a question, and my response was that if you had meetings, that it should be required that people be vaccinated or demonstrate evidence that they're negative to COVID. But I don't know what the popular decision was or what the survey showed.
The last thing that they did, I got an email a couple of days ago saying that we're going to have a meeting on the 23rd of June, and they're going to do it virtually and in person. And I guess they're going to kind of see who's going to show up in person. I don't know. They'll move forward from there, I guess.
Churches and businesses, or maybe I should say other businesses, have the right to determine who's going to come in at all. So
that's what I thought.
I have absolutely no problem with any place demanding anything, masks or vaccinations or anything.
That's exactly what I thought when I asked the question.
Yeah.
The issue for me is whether they can require you to show your vaccination cards, both of them.
Yeah.
The first one and the second one.
Well, they don't have to require, they can ask. See, requiring is one thing, asking is another.
Yeah, they can't require you, is my point. They can't require you to show.
But they can ask you.
Yes. Yes, they can ask you.
But they can also not allow you to come in if you don't.
They can do that too.
Yeah.
Yeah.
And why not require? What is the big deal?
That's what I'm saying.
I don't know.
I'm sorry. Why do they make up these cockamamie rules and say that you can't ask somebody?
Right.
And the policeman can't ask you for your driver's license.
Right.
I mean, we're free.
Yeah.
But they make up these rules that don't make any sense.
Wait a minute.
Why not? If you got your vaccination, you got it. If you don't, just stay out.
It's
Wait
the
a minute.
land of
Agree
the
with
free and
you.
the home of the
Always
brave. That's
doing
the
Back
that's
up
the
for a
thing.
minute though, Carol. If a police officer stops you on the street in your car, they
You
do
have to have a
have,
license.
yeah, they can ask you for your license.
Yeah.
You have to have a license. That's required by law.
Okay, so if that policeman can ask you while you driving a car because it's a law, why
Right.
can't a church that doesn't have these rules ask you for your vaccination to protect themselves and
Right.
other
They
members?
can't.
No reason.
They
They
No
can.
can't.
reason.
They
Right.
can.
They can't.
A-
No.
Yeah, they
Why
can.
can't they?
I
Absolutely.
mean, they can ask you,
Yeah.
but it's not required that you produce it.
Then if it's not required, then just stay out. Say, I don't
Right.
have
That's right.
Yeah, but then
That's
stay
true.
away.
and
Yeah.
then you wasted a trip though. You
That's-
wasted a
Right.
trip
That's
going
your
down to
problem.
If you know already they're not gonna take it, then don't go.
Right.
That's
I
your
You don't
agree.
have a
problem.
ticket
Yeah.
to get in.
Look,
just
if they can take your temperature, they can ask you about whether you've been
Right.
vaccinated.
You
don't
know?
say, don't
and they
take
can
my
ask
temperature.
they can ask everything. But
Yeah.
then you have to go back home. And
They
so
don't ask,
and
they
Dr.
don't
Calendar, this is part of reopening anxiety.
they don't ask you if you want to have your temperature taken.
Right.
Right, right.
No,
right.
don't do that. And one thing we must not forget is as Christians, we believe in the Lord and it's a church, you know, what is wrong in showing, okay, I'm vaccinated, here it is, because we want to protect our elderly, our children, our Christian brothers and sisters. You know, I'm willing to cooperate. You know, we have a lot of elderly people in the churches, a lot of people who are disabled, you know, it's okay for the sake of Jesus Christ. I'm going to do it. Here it is. Nobody's going to just, yeah, it's okay. Let us do it, you know?
Okay, Maya, I'm gonna start carrying around my evidence in my pocket, you know, my my 2 shots. I'm gonna put it in my wallet.
Yeah, for your
Yeah,
Christian
I'm gonna put it in
brothers
my
and
passport.
sisters.
I
I'll
carry
put it in my
mine.
passport.
I carry mine too. I carry mine.
I carry mine.
Me too.
Janice, we haven't heard from you today.
Who was that?
See,
We
you're
haven't
on
heard from
mute.
Janice today.
You're on mute, Janice. You're on mute.
Oh,
Unmute. There
I'm
we go.
good.
Yes, she is.
Mhm.
You're
You
good.
okay?
Yes, yeah.
Are you gonna carry your
No, I don't care.
vaccination cards around with you?
No, I don't think we should have to.
You don't have to.
And then we had that debate, do you laminate? I know people that laminated,
oh
but they
no.
said you shouldn't laminate
Right.
because they have
Right.
to put your booster on
Right.
there.
Right.
Right.
So, but no, I don't carry my vaccination card.
Yeah, I'm gonna
Should
put it
we?
in my passport.
Do you think we should, Dr. Calendar?
I don't think you need to carry it around, but
Yeah.
I have a passport because I don't drive and I don't have a
Right.
driver's license. So I use
Okay.
that as my main ID.
Right.
And
Okay.
I think it's a good idea for me to put it in that, so in case anybody asks. But you know, it's, I was surprised that even when you travel, that it doesn't do you much good because they're gonna, when you go to other countries, they're going to force you to get tested anyway.
Well, I
Right.
don't carry mine because it's not laminated. Here's
Right.
my
Yeah.
wallet. It's just one more thing to add to my wallet, and it's important.
Take a
So,
picture of it put it on your phone.
Yeah,
and
Yeah,
that's what
that's what
I did.
that's what I
That's
did.
what I've done.
Yeah.
Yeah,
Yeah,
That's
take a
how I
picture
carry.
of it.
Done that.
Yeah,
You
I
can
had
take
the
a picture of
picture.
it.
Yeah.
Both
Yeah.
sides.
Yes.
So you have an extra, that's what.
Yeah.
But
Yeah.
the thing about it though is that you can carry it around all you want to, but it doesn't mean that you're negative for COVID.
There you go.
Doesn't mean what?
You're negative for COVID.
Yeah, that's
Oh,
true.
that's true.
That's true.
Well, it means that you're vaccinated against receiving COVID. That's what it
That's
means.
true, but you can
That's all.
still get it.
Yeah, and that's why every country has its own rules, so you
Right.
can
Right.
still test you. And what's interesting, they test you before you arrive, and they test you when you get ready to go back home. So they really don't trust that anything.
Every country, every city, every state.
Well, anyway, we've had an interesting session again, and so you all have a nice weekend. And
and happy Father's Day to the fathers.
Yes.
oh, that's
Happy
right.
Father's
Happy
Day.
Father's Day.
Enjoy it. Enjoy your
Thank
day.
you.
Yeah.
Yeah.
All right. Thank you, Ben.
Hey,
Enjoy.
tell
Thank you
your
very
husband
much. Thank
happy
you very much.
Father's Day. I
Thank
see him
you.
in the background.
Everybody.
Yeah.
Yes, yes.
Yeah.
Thank you so
Charles.
much.
Yeah.
Thank you.
You're welcome.
Yeah.
All righty.
Okay. Take care.
Have a great
See you.
week.
Thank you,
All righty,
Dr.
thank
Callender.
you.
Thank you.
John
Thank
Buchanan.
you.